Hi everyone, my name is Jenny DIOUF, and I am a French music therapist and currently doctorate student in Ewha Women's University in Seoul, South Korea. Today, I will talk to you about a music therapy clinical case study of a man with delirium, Paul's friendly melody. Paul was an 81-year-old man, retired plumber. His wife passed away 5 years prior his hospitalization. Even though he was 81-year-old, Paul was very independent. He lived alone, but was frequently visited by his son, his 3 daughters, and 7 grandchildren. He was quite active. He liked gardening and was often going out to Lotto or Bingo Club or to play pétanque in the neighborhood, which is a very popular ball game in the south of France. He was pretty healthy and not showing much aging symptoms. His sight and hearing just began to decline. But suddenly, Paul's family members could not recognize him. They say he went from happy, jolly, and calm person to aggressive, confused, and agitated person. Because of his rapid mood change and behavior change, Paul was placed in the geriatric medicine unit of the hospital where he was diagnosed with Alzheimer's disorder. Then, a week later, other symptoms such as cognitive decline, disorientation, aggressivity, restlessness occurred. He was transferred to a cognitive and behavior unit of the hospital. There, he was diagnosed with hyperactive delirium, and he received 2 months of treatment. Despite this treatment, he became more aggressive, more agitated, more disorientated, and particularly violent toward the medical staff. That is why he was transferred to the gerontopsychiatric unit of the hospital. He arrived contentioned and was given a lot of sedative to control his restlessness. In the unit, he was described as not cooperative, always swearing, spitting on nurses. We can say he rarely went out of his room, only for lunch or dinner, or to walk in the garden. Even if the gerontopsychiatric unit offered paramedical services such as occupational therapy, art therapy, physiotherapy, snoozling, and music therapy, of course, he refused to participate to any activities because he did not want to get to know other patients. First, I need to explain to you a bit more about Paul's diagnosis, which is hyperactive delirium. Delirium is also called confusional state, and it's a serious disturbance in mental disabilities that results in confused thinking with poor memory, disorientation, difficulties in speaking and understanding speech. It also results in inattention and reduced awareness of the environment. So the client shows difficulties to focus on a topic, is very distracted, he has reduced activity or reduced responses to the environment. It also results in behavioral and emotional changes with things like having hallucinations, restlessness, rapid mood changes, irritability, and anger. Delirium is not to be confused with dementia. While dementia is very progressive and irreversible, delirium has a rapid start, like within hours or few days, and is irreversible. The main deficit in delirium is the inattention. Paul's music therapy intervention. So, as I mentioned before, in the gerontopsychiatric unit of the hospital, the main duration stay was 21 days. So for the medical staff, it was urgent to find the appropriate drugs to stabilize the patient's states and to let them go back home or transfer them into other treatment units. For Paul, the main goal was to reduce his confusion state and aggressive behaviors. So on the third day of his hospitalization in the gerontopsychiatric unit, Paul was oriented to music therapy because he likes music and used to play violin when he was young. And also, he said music cannot hurt. Therefore, the music therapy intervention for him was composed of two phases. The first phase, with the objective of increasing his attention and here and now awareness, with activities such as rhythmic dialogues and rhythmic improvisation. Then, the second phase was aiming to promote emotional and behavioral changes through self-expression by using musical improvisation. Paul beneficiated of 30 minutes of music therapy sessions twice a week for 3 weeks during his duration stay, so a total of 6 sessions. In the first session, I called it the friendly melody, because in the first session, Paul came to the music therapy room accompanied by a caregiver in case of if he was showing aggressive behaviors. And I explained that I was a music therapist and I simply use music to help people. So he told me first that he didn't want to know anything about it. However, he kept staring at the instruments, and when I invited him to play them, he refused, saying that he does not want to play anything anymore since he left his band. He told me he used to play the violin when he was young. And while talking, he was changing constantly the subject of his conversation. But I could see that he kept staring at the instruments. He stared at them and started to ask questions. What are their names? What are they made of? At the end, he saw my flute and asked if I could play it. And I said, yes, not everything, but if he has something in mind, and maybe if he could sing it, maybe I could play it with the flute. And that is how he taught me the friendly melody. So the friendly melody is actually a melody that he used to play when he was young with his band members in his neighborhood, and it was a signal to gather and to play together. He sang it, and I played it. It goes like this. After I played this friendly melody to him, I could see his face lighting up. He told me, "Oh, this is great, but keep it secret." Then, this is the second session. In the second session, I wanted to initiate rhythmic dialogues with Paul. Even though he came spontaneously in the music therapy room, he refused to play any instruments. So I took my flute and I played the friendly melody that he taught me in the last session. He seemed surprised and asked me, "How do I know this melody?" I said, "Well, you sung it to me, and you told me it was a signal to gather and play together." He smiled and said, "Oh, okay, now I have to play with you." He stared at the instruments for a moment without touching them, and before choosing the maracas. I took the other pair of the maracas and I invited him to play the dialogue. So I play, you play, through a rhythmic dialogue with the maracas. The improvisation continued for a moment, and after we did the same by using the pedal drum, the djembe, and the egg shakers. So during those rhythmic dialogues, he was imitating some of my rhythms, or sometimes I was imitating some of his. At the end of the session, he said that he spent a good time and that reminded him the joy that he had when he played with his band when he was young. He expressed about the feeling of freedom that music gave him when he was young. In the third session, I wanted to focus on the rhythmic improvisation to explore the feeling of freedom that he expressed in the session 2. I started by playing the friendly melody, and when he was ready to play, I proposed that we play all the instruments like the way he wants, with no rules, to illustrate the theme of freedom. So he started with the paddle drum. He was playing loudly a regular pulse on it. Then he kept the paddle drum's mallet and he hit all the instruments on his way. Then he stopped to the djembe and improvised diverse rhythms before moving to the ocean drum. That he hit first with the mallet, and then he heard the sound of the little metallic beds that are inside of the ocean drum. And so he left the mallet on the table and he took the ocean drum with his 2 hands and he started asking me about it. How was it made? What is inside? And I told him that if he waves it smoothly, he could maybe hear the sound of the ocean. So he spent the rest of the improvisation time trying to recreate the sound of the ocean with the ocean drum. He was so focused that he did not even realize that I stopped playing for more than 5 minutes. So at the end of the session, he expressed that playing without rules made him feel free for a moment. He also said that he missed the freedom that he had when he was at home. Even if the unit was colorful and had a nice garden, he could feel that he was not completely free. He said that he was not sad about it, but he hoped to go home very soon. From his house, he could actually see and hear the Mediterranean Sea. So playing the ocean drum reminded him of his home and this peaceful environment. In the fourth session, I wanted to enter in the second phase and let more space for himself expression through music improvisation. So as soon as I finished to play the friendly melody, he told me he really liked to play the theme of freedom at the last session. So I proposed to do the same, but with the theme that he wanted. It was a little difficult for him to choose the theme at first, so I helped him by proposing words such as joy, sadness, anger, nature. He said no to all of them, except to nature that he likes. When I asked him which element of nature he liked the most and he wanted to represent in the music, he did not hesitate and he said the sun. So he chose sun and bright as the main theme of the improvisation of the day. Thus, I let him choose the instruments that represent more the sun for him to start the improvisation. He chose the paddle drum, in which he improvised for 10 minutes. Then he chose the maracas, in which he improvised for 12 minutes straight. He used diverse tempi and rhythms, and I was playing along with my flute. For example, when he was doing those rhythms like da, 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 I was playing like bum, 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 bum. I was playing along by using the rhythms that he was using. And at the end of the session, he even started to dance. I uh, I asked him about how he felt in the session, and he verbalized that he had fun and that playing the theme of the sun reminded him of his youth doing summer jobs on the fields, and all the happiness and all the joyful moments that he had at that time. He associated those moments with it. And he also compared this improvisation and also the summer job memory with the reality of his own grandchildren who now have difficulties to find summer jobs. Then in the fifth session, I wanted to get more into the emotional dimension of Paul by using melodic instruments. So I started, as usual, by playing the friendly melody that he taught me and presenting to him the rainbow chimes. I told him that it was like a small, parted, but very colorful piano in which he could play anything he wanted. He explored the rainbow chime with one mallet first, and he searched for a lot of notes, and at one point he started to search for the friendly melody notes. When he found it, he played it, and I played along with him with my flute. And he said, "Now we can play together." Then I took one mallet and I started to initiate a melodic dialogue with him. Afterward, he took the two mallets, and so I took my flute, and we improvised also a rhythmic dialogue. So he was playing, I was playing, he was playing, I was playing. At last, I invited him to improvise and create his own melody. And I told him that I would just follow what he was doing with the guitar. And so he searched and he improvised like this for 10 minutes. At the end of the session, he verbalized how great it is to play with other people. Even playing the rainbow chimes made him feel like having an orchestra in his hands. He said that the session was pleasant and that he felt relaxed. He talked about his old band members, his band, the music they were doing, and he thought of playing music with his grandchild that now is learning guitar when he will go back home. Then the last session came, the sixth session. It was Paul's last music therapy session at the Geronto Psychiatric Unit because the unit decided to send him back home the next day because of his stabilized state. So, as usual, as the other sessions, I started by playing the friendly melody on the flute, and he played along with me with the rainbow chimes. So for this last session, I asked him to play his actual feeling, how he was feeling, knowing that he was going back home. And I told him he could play any instrument in the way he wanted. He chose the rainbow chimes, and as he told me that the rainbow chimes helped him to more express himself. And he started not by improvising, but by searching some known melodies like La Marseillaise, our national anthem, which is ta 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 ta. And also, he searched another very popular child song, which is Au clair de la lune. Tan 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 tan. He was searching those melodies, and then after that, he started to improvise his own melody, his own music for about 15 minutes straight. At the end of the session, he said that he could play music all day. He could do that all day as it made him feel great, relaxed, and forget about his problems. He said that creating music helped him feel better and that his grandson that plays guitar was ready to play with him when he will go back home tomorrow. So, in conclusion, music therapy intervention for Paul was particularly effective in various aspects. It was short, it was 6 sessions, but we could see a big change in Paul's attitude. So, first, it changed in increasing his attention. So, Paul gained more attention and more focus in his actions and discussion topics, especially when he was improvising his own melodies. He could stay focused on his themes and variation. Also, when he was talking about his summer job, when he was young, he linked the idea and the topic directly to his grandchildren. Before that, he would just change subject, but now he was making a connection and maintaining the conversation topic. Second, in improvising and creating his own music, Paul could express himself and be aware of his emotions. He realized that his anger and aggressive behaviors were linked to the fact that he was not completely free as he wished to be. But through music, he experienced again the feeling of freedom. Third, even if the music therapy intervention was short, a lot happened, especially in changing Paul's um, emotional state, but also changing the medical staff vision and perspective about Paul's aggressive behavior. Remember, what he was always described as not cooperative, always swearing, spitting on nurses and other caregivers. And after music therapy intervention, according to the medical staff, Paul was easier to work with just after music therapy sessions. And so the comparison between his attitude in and outside of music therapy led to reduce and somehow adapt his medication intake. This is why non-medical therapies like music therapy are important to really get to meet the client's inner personality other than from their symptoms, for the symptoms of their pathology. Also, the friendly melody has a very strong role in this music therapy intervention because it was the key element of our therapeutic relationship. I can say that the friendly melody was the signal that aroused him to the present moment. It was the signal that he was in a peaceful environment for music and for interactions. He could focus on his own music, his own improvisation, while being aware of what I was doing around him with the flute or the guitar. The friendly melody took the role of the main mediator. It was the bridge that was bringing Paul into the session and encouraging him to play and just be himself. Thank you for listening to my presentation. Shukran!